Hello, I'm Suzanne Mason. I'm a Professor of Emergency Medicine at the School of Health and Related Research in the University of Sheffield. I'm also a Clinical Director for Research and Development here at Barnsley Hospital and a consultant in the Emergency Department here. I came to Barnsley Hospital about 3.5 years ago when, through some of the research that I've been delivering around the region, I gave a presentation here, and I think it got them interested in some of the work that we've done, particularly in urgent care. And I was approached to see if I'd like to come and work here as the Clinical Director for Research and Development and help to develop the research across the hospital, which I've been doing for the past 3 years now. My research that I mainly do at the university, but some of it touches the hospitals around the region, is around understanding what drives demand in urgent and emergency care. So it's all embedded around ambulance services, emergency departments and other urgent care settings. I'm really particularly interested in how we can drive up quality and improve patient outcomes across the whole of the region, and to test different types of delivering, different ways of delivering care for patients that will improve their experiences and their health. One of the biggest challenges we face in this region is the high levels of deprivation and the poor health outcomes as a result of that. We're one of the most deprived regions in the country, and we have therefore many patients who've got multiple long-term conditions and lots of what we call unmet health needs out in the population. So where there are populations which are quite hard to reach and find it difficult to access healthcare and perhaps don't get the best care that they need at the moment. So this is really driving what we should be doing in the region, which is joining up healthcare, but also really trying to reach those populations where there are the most challenges. One of the big things that we're doing in our research is trying to gather information about patients. So a fairly unique thing that we've managed to do for the whole of Yorkshire and the Humber, but we do a lot of work around South Yorkshire focused on this, is getting routine data which helps us to understand health journeys that patients take. So we've linked data that helps us to understand when a patient calls a 999 number or they call the 111 service, what happens after that and how well do they do when they've been in contact with those services, and do those services deliver the type of care that's needed for them. We feel this is a fairly unique linkage study that we've done for the whole of the region. There aren't other places in the country doing that, so we get a fairly clear insight into how urgent and emergency care is working for the region. I really love working here at Barnsley Hospital because it's a fantastic environment to work in. It's not only really supportive, but the staff and the patients are just amazing. They are full of enthusiasm and really positive about working in a hospital like this. But the fact that we can bring research and give patients the opportunity to get involved in research in a way that they may not have had in the past is really exciting, and that was never more of the case than when we ran our own vaccine trial here and we gave patients the opportunities to participate in a vaccine trial for the COVID pandemic, and that was really exciting and breaking new territory for Barnsley, which was great.